Blood clots might not seem like a big deal at first, but they can turn deadly in no time. The scary part is they often show up without any warning. Many people don't even know they have a clot until it becomes a serious medical emergency. And here's something you might not know. Clots don't just happen to older people or those with health problems. They can happen to anyone, including healthy, active people. That's why it's so important to learn about blood clots, what causes them, how to recognize the signs, and what you can do to prevent them. Stay with us, and don't forget to subscribe to Earthluxe for more helpful and life-saving health tips. What are blood clots? Let's break it down. A blood clot is when your blood turns from a liquid to a thick, gel-like state. Your body does this naturally to stop bleeding when you get a cut or injury, and that's a good thing. But when clots form inside your veins without a good reason, it's a problem. It's like a roadblock in your veins that stops blood from flowing smoothly. Why do these clots form? There are a few reasons. One of the biggest causes is sitting still for too long. Think about being on a long flight, stuck in a car, or even recovering in bed after surgery. When you're not moving much, your blood flow slows down, and that increases the chance of clots forming. Dehydration is another big reason. When you're not drinking enough water, your blood becomes thicker, and that makes it easier for clots to form. Other risk factors include smoking, being overweight, certain medications, and even genetics. If someone in your family has had a blood clot, your risk might be higher too. The important thing to remember is this: blood clots can happen to anyone. You don't have to be old or sick, and the more you know, the safer you'll be. Why are blood clots so dangerous? Here's the thing about blood clots. They're not always dangerous, but they can become deadly very quickly. When a clot forms in a deep vein, usually in your legs, it's called deep vein thrombosis, or DVT. Now, if that clot stays in one place, it might just cause pain or swelling. But if it breaks loose and travels to your lungs, it can cause a pulmonary embolism. And that's where things get really dangerous. A pulmonary embolism can block blood flow to your lungs, and that can be life-threatening. You might feel short of breath, have chest pain, or notice your heart beating faster than normal. These symptoms can come on suddenly, and they're a sign that you need medical help right away. This isn't something you can wait out. Even if a clot doesn't move to your lungs, it can still cause long-term damage. Some people develop something called post-thrombotic syndrome. This can leave you with swelling, pain, or even skin changes in the affected area. It can make daily life really uncomfortable. So, yeah, blood clots are a big deal. They're not something to ignore or hope will go away on their own. How to recognize a blood clot. Knowing the signs of a blood clot can save your life. If a clot forms in a deep vein, you might notice swelling in one leg. The area might feel warm to the touch, and it could look red or discolored. Sometimes you'll feel pain in your leg, especially in the calf. It might feel like a cramp or a pulled muscle. If a clot moves to your lungs, the symptoms are different. You could suddenly feel short of breath, have sharp chest pain, or notice that your heart is racing. Sometimes, people even feel dizzy or faint. If any of these things happen, don't wait. Call for help right away. Time is critical when it comes to blood clots. And here's something important. Not all clots show symptoms. Some are silent. That's why prevention is so important, especially if you're at risk.
How to prevent blood clots. The good news is, there's a lot you can do to prevent blood clots. And the best part? These are simple, everyday changes that anyone can make. First, stay active. Movement is one of the best ways to keep your blood flowing. If you're sitting for a long time, whether you're traveling, working at a desk, or even just watching TV, make it a habit to move around every hour. Stand up, stretch your legs, or take a quick walk. Even small movements, like wiggling your toes or flexing your feet, can make a big difference. Next, drink plenty of water. Staying hydrated keeps your blood thinner, which makes it harder for clots to form. So, carry a water bottle with you and sip on it throughout the day. If you smoke, quitting is one of the most powerful things you can do to protect yourself. Smoking damages your blood vessels and makes clots more likely. And if you're carrying extra weight, losing even a little can take pressure off your veins and improve your overall health. Another tip? Avoid wearing tight clothing, especially if you're sitting for long periods. Tight clothes can restrict blood flow, and you want to keep everything moving as smoothly as possible. Lastly, Talk to your doctor if you're on medications like birth control or hormone therapy. These can sometimes increase your risk of clots, so it's important to understand your options.
Natural ways to support healthy blood flow. Sometimes, even with the best prevention, clots can still form. That's why it's essential to focus on natural ways to support healthy blood circulation and reduce your risk. Herbs like turmeric and ginger are known for their anti-inflammatory and blood-thinning properties, which can help keep your blood flowing smoothly. Adding these to your diet, whether as a tea, spice, or supplement, can be a powerful way to support your circulatory system. Compression techniques, like gentle massage or using natural movement exercises such as yoga, can also promote better blood flow, especially in your legs. Staying hydrated is another simple yet effective practice. Water helps keep your blood less viscous, reducing the chance of clots. For those looking for additional natural support, consider foods rich in omega-3 fatty acids, like flax seeds, walnuts, and salmon. These can promote cardiovascular health and reduce clotting risks. The key is to listen to your body. If you ever feel unusual discomfort or persistent symptoms, focus on these natural remedies to support your overall health and maintain balance in your body.
Myths about blood clots. There are a lot of myths about blood clots that need to be cleared up. One of the biggest myths is that clots only happen to older people or those with major health problems. That's not true. Blood clots can happen to anyone, no matter your age or fitness level. If you're inactive for long periods or have risk factors, you're still at risk. Another myth is that clots always cause pain or swelling. While these are common symptoms, not all clots show signs. Some clots are completely silent until they cause a serious problem, like a pulmonary embolism. That's why awareness and prevention are so important. Why we need to talk about blood clots. Blood clots don't get enough attention. Millions of people are affected every year, but most people don't even know how serious they can be. That's why it's so important to talk about this. Share what you've learned with your friends and family. Even a simple conversation can make a big difference. Encourage the people around you to stay active, drink water, and know the warning signs. These small steps can save lives. Your health is your most valuable asset, so take care of it. If this video helped you learn something new, share it with someone you care about. Hit the like button if you found it helpful, and don't forget to subscribe to Earthluxe for more simple, life-saving tips. Thanks for watching, and we'll see you in the next video.